Hi guys, this is Dr. Ahmed Ergin. I'm an endocrinologist, and today I am going to talk to you about thyroid symptoms and signs. Now, of course, I see a lot of thyroid patients in my clinic on a day-to-day basis, and I realize that a lot of my patients do not have enough knowledge, or they are misinformed, unfortunately, because their sources are not reliable. And here I am trying to dedicate my time to you guys so you can get the right information, hopefully from the right person, because everything I'm going to tell you is going to be based on scientific evidence. Now, hypothyroidism is definitely a problem that can affect your entire body. Now, when we say hypothyroidism, we are talking about underactive thyroid. It's called hypo. Now, hyper is the overactive thyroid, which totally has different set of symptoms. Now, the symptoms of hypothyroidism can definitely be confused with symptoms of other diseases. I am not saying that these symptoms that I'm going to talk to you about today is going to be only pertinent to thyroid. So, for example, you may have fatigue due to hypothyroidism, but you may have fatigue from a lot of other diseases as well. So one misconception that I hear all the time is just because you are gaining weight does not necessarily mean that you have hypothyroidism 100%. But it's definitely your doctor should look into your thyroid with a complete thyroid panel. Now, of course, I'm going to tell you everything that your body will feel from hypothyroidism. Now, symptoms of hypothyroidism, by the way, depends on how quickly that situation happened, in this case underactive thyroid. So it can happen within weeks. It can happen immediately after surgery if they removed your thyroid. It can happen very gradually, like in Hashimoto's thyroiditis. It can happen due to a medication, so it can happen within weeks, it can happen within months, or it can happen within years. So the quicker it is, the faster you are going to feel symptoms. So it's pretty much true in almost all disorders, but hypothyroidism definitely is something that can slowly kick in. You may not even realize those symptoms we are talking about. Again, the symptoms are more prominent when you get the problem very acutely. For example, after pregnancy, sometimes women will go into thyroid problems and they will immediately realize that there is a problem and their symptoms are very obvious. I'm going to go by system, and I'm going to start with skin symptoms. Okay, so let's look into that. So when I talk about skin, I'm talking about skin, hair, and nails, of course. So let's review those symptoms quickly. Of course, so when you have hypothyroidism, your skin will be cool and pale due to decreased blood flow. You will have atrophic layers of cells. You will have decreased sweating, and that will be a skin discoloration in some cases. Now, yellowish tinge may be present if patient has carotenemia, but sometimes even excessive pigmentation or dark coloration can happen if hypothyroidism is associated with primary adrenal failure. The skin can be coarse, hair loss is very common, and nails become brittle. And non-pitting edema, which we call as myxedema, is also fairly common, and that results from the infiltration from glycosaminoglycans, and that causes water retention, and it creates a puffy appearance. In some cases, when autoimmune thyroiditis is the reason, vitiligo, which is losing the color of the skin and turning white, and total baldness can also be associated due to autoimmune attack to these cells. The same thing can happen around the eyes as well. You may have puffy eyes from the accumulation of these glycosaminoglycans, and sometimes Graves' disease will affect your eyes as well. However, that's typically associated with hyperthyroidism. Sometimes hematologic problems can happen, which could be anemia. Now, of course, when thyroid is low in your body, every organ pretty much slows down. And when that happens, Patients with hypothyroidism may have anemia that is mild to moderate in severity. Sometimes patients with autoimmune thyroiditis may end up having pernicious anemia, in which case patients will lose the ability to absorb B12, and that will lead to a different type of anemia than the typical anemia seen with hypothyroidism. Of course, when women have hypothyroidism, their periods will become irregular. Sometimes it becomes more frequent, sometimes it becomes less frequent, sometimes it causes excessive bleeding. When excessive bleeding or frequent periods happen, then that leads to excessive blood loss that also cause anemia as well. When it comes to cardiovascular system, your thyroid definitely will affect your heart, guys, and what will happen is your thyroid will lose its contractility, it will slow down, and basically you may even have some fluid accumulation around your heart, and that can lead to slow down of your heart. Your heart rate may go down, and your blood pressure may go up with the situation, and most importantly, high cholesterol, especially elevated LDL, is not uncommon with patients who have undiagnosed hypothyroidism. Now, one important caveat, if you have underlying heart disorders such as coronary artery disease with stent placement or bypass surgery, or if you have active chest pain, etc., your doctor should start thyroid medication at a very low dose and very gradually increase it, because when you introduce a thyroid hormone after a period of deficiency of thyroid hormone, it can lead to a excessive demand on your heart and can lead to a heart attack. Even your respiratory system will be affected, so your muscles will be weaker, so you're going to have difficulty breathing. Your heart and lung will function less, because thyroid basically helps function pretty much in every organ, and that will lead to excessive labor breathing. Sleep apnea can become worse. Your tongue may become large, especially if it is not treated in the long term. And when it comes to gastrointestinal findings, of course, the most common problem is constipation. Again, constipation can happen from a variety of reasons, but I think hypothyroidism is one of the most common things you have to exclude first. Of course, the hypothyroidism can bring celiac disease with it. Patients with hypothyroidism are 4 times more likely to have celiac disease. So if somebody complains about gastrointestinal symptoms when they have Hashimoto's thyroiditis, for example, one of the first things we look at is celiac disease. In addition to that, atrophic gastritis can happen from pernicious anemia. That is another common problem that goes along with hypothyroidism. And surprisingly, it can even affect your taste sensation. So these are the most common gastrointestinal findings. Sometimes, due to the weight gain, fatty liver infiltration, fatty infiltration of the liver can happen as well. When it comes to neurological manifestations, it's not uncommon for patients to complain about muscle pains, neuropathy. Even peripheral neuropathy is one of the most common things that happen with hypothyroidism, but myopathy, which is muscle dysfunction and muscle pains, are also common with hypothyroidism. The Hashimoto's encephalitis, which is a condition where patients become extremely confused, they end up in the ICU, it's a controversial phenomenon. There is no really diagnostic test that can prove that some of these patients who have confusion and hypothyroidism at the same time or is due to, for example, Hashimoto's encephalitis. But there is a phenomenon described by some physicians. A couple other notes, guys, to remember: when you have hypothyroidism, everything is slow in your body. So clearance of medications will be slow as well. So if you're on medications that are very critical in terms of following the levels, this could be, for example, anti-seizure medications. This could be anticoagulation medications like blood thinners. When you are hypothyroid, your drug levels in your blood may change, so you have to let your doctor know that that is a situation, so they may follow your levels a little bit more carefully. When it comes to reproductive changes, as we discussed, women may have period problems like frequent periods or less frequent periods or excessive bleeding, etc. But interestingly, in men who have hypothyroidism, their testosterone levels may go low and they may have decreased libido and erectile dysfunction. One last thing before you go. If you have carpal tunnel syndrome, that can also be due to hypothyroidism and can definitely be reversed when hypothyroidism is treated. So, the next question, can these symptoms and signs go away after treatment with thyroid hormone replacement? That is a big question. Sometimes they do, sometimes they don't. Sometimes the medication you use makes a difference. Sometimes treating hypothyroidism can uncover other problems. So, it is not that simple, but definitely you can improve your symptoms if you are carefully treating your hypothyroidism, and if you are also keeping an open mind that your symptoms can be due to other problems as well. So, we'll talk more about these thyroid issues, and I'll see you in the next video.